and trying to get our parents prepared and our families prepared, but mostly wanting to get our programs prepared, because what tends to happen when there's a disruption in safety nets is our parents will either lean into us, or they will lean into a situation that gets them more stable. And so we don't want to put our parents in a position where they're having to make a choice to no longer participate in our programs. So hearing that they're going to be in a looming place where they're about to not have access to their um, food stamp subsidies, a lot of our programs are looking at how can we support them, because it's going to end up landing with us eventually. If the families are in a real crisis situation and they have assigned copay fees, we will see those fees immediately get reallocated, because they have to make sure they're feeding their families first, right? We take care of our purse, our our bodily needs before we'll take care of our financials. So yeah, it's for Ohio, it's showing up in a multi-lens because we were already going through an adjustment due to some budget decisions that were put in some of our sectors of the industry at financial risk. But to now also be dealing with this, what doesn't seem like a looming possibility, it's a written guarantee that November 1st, if the shutdown continues, our families will lose access to their food stamps. Um, we're looking into finding how we can stabilize them in food resources, checking in with our local pantries to see how they're responding to the possible um, food shortages that may impact some of our families we're serving. And then also looking at our own resources to see how we can offer some stabilities for the families we're connected to through our programs, with an understanding that we're going to be dealing with some financial setbacks ourselves. Through the budget, Ohio made a decision to change the threshold service for our families who are eligible for childcare assistance. So it adds an additional 8 hours a week to each of our programs in service. And so that turns into increased wages for a lot of our programs. But we also had this decision in the budget that family childcare, our larger family childcare programs, reimbursement rates are being reduced to what our smaller family childcare program reimbursement rates are. So the timing of the shutdown in Ohio is horribly at the wrong time. Um, but the only thing we can do is just look at what are we working with, what are we operating in, and how can we soften the blow for our families.
And when you say soften the blow for families, my assumption is that many of these families are already struggling and already like doing their best to make ends meet. Is that a safe assumption?
It absolutely is. Ohio has the lowest eligibility rate across the nation. Our families are operating at um, closer to the 145, 150% of the poverty level. Those that are tied to copays are still below to 200% of the poverty level. So yeah, they're relying on those safety nets to help them be stable.
What does it feel like to you? I know that, you've been a childcare provider for a long time. You work with a lot of families. What does it feel like to you to face the prospect of maybe children coming and they're hungry, or, added stress on parents for not having what they need for their families? How is that prospect sitting with you?
I mean, it does add some extra pressure because we're already going into a financial adjustment for a majority of our programs in Ohio. Um, so there is some real pressure to try to meet needs in between. I mean, I'll be honest with you, this is not the first time I've had to operate in a space where we're dealing with food insecurities with our children. But my program was in a more stable space when that was happening. I wasn't going through my own financial adjustment at the same time. So some of the things we've done in the past is create them food baskets or take homes. That is what we like to call them. So on the weekends we'd give them some of the things we put pantries together, give them some of the things that they can take home and make sure that the children are still having nutritional meals when even when they're away from our programs. But with the financial shutdown in our own state dealing with its own budget changes, it's definitely put a lot of pressure on if I can still show up in that same capacity, or I can provide the takeaways or the additional food support so that the children are just so that the children are not going home with dealing with real food insecurities.
Thank you. And is there anything that I didn't ask you that, you wanna share?
um, I just want to say that, in all of these changes, the one of the things that we do really well when we're in these crisis spaces is leaning into community. And so providing resources for your families with what resources are in the communities that they can go access food at or some kind of financial assistance programs. There are still programs out there. And I do know that some of our pantries are starting to bulk up because they know that the need is going to severely increase November 1st. Research what your areas are offering, put some resources together so that the families can have somewhere to go while all programs adjusting to this current phase right now in the world.